Hello everybody, my name is Cruz, and today I'll be talking to you about the ethical issues of in research surrounding communication. So, principles of scientific communication. So, this is including but not limited to accuracy, clarity, reliability, and understandability. As Don Bovee, 2013 states, principles of scientific communication are clarity, clearly written, accuracy, accurate data, simplicity, easily accessible reports of medical studies, and understandability. So, ethical implications in human research that apply to allied health care are patient privacy, confidentiality, maintaining patient safety, and providing patient rights. These ethical implications are all very important due to the fact that an allied healthcare professional should maintain these and continue to provide care and competence. Patient privacy and confidentiality is really important. It kind of ties into maintaining the patient's safety. So if you don't keep the patient's privacy and their information confident, that could lead to their overall safety. And just making sure that they have, you're providing the patient's rights with that as well. So the ethical issues are communication when conducting research in allied healthcare field are informed consent, privacy, and benefits. Having informed consent with patients before proceeding with any medical treatments or even photo releases and so on are very important. These ethical issues keep the patient's information private and allows the patient's safety to be the top priority. And then just describing how I would communicate effectively and appropriately with patients, families, and healthcare providers within the scope of practice. So how I would do that would be actively listening. This way the patient understands that I have their best interest. They know that I'm listening to them. They're able to, trust me and give any other anything else they want to share with me. Clinical communication is just really important in the healthcare setting just because you want to make sure that all providers, no matter the scope of practice, are all on the same page, making sure that you have any notes that you're sharing with the providers. Interpersonal communication is really important as well. Just make sure that you and that patient has that bond and trust. That way they're able to tell you anything, especially with their families. They're able to communicate with you and have you understand it as a whole. Responding effectively, just make sure you're actively listening and responding to the patient as well. You don't want to be sitting there and ignoring the patient. And then maintaining non-judgmental attitude. This one's really important no matter their ethnicity, religious views, or anything of that sort. And then just having the correct body language as well. And then I would demonstrate effective skills in writing formal correspondence to communicate information and ideas the medical provider should use is the correct tone. This just shows that you're having interest and passion so the patient can connect with you. Making it simple, that way the patient's not overly confused with all these medical terms. It can be a lot when taken in. So the medical provider conveys the message but with expressing the right feelings. And then just stating the goal. We all have the patient's best interest and safety at heart. So the way the patient knows that you have their best interest at heart ultimately. But that's all I have for today. Thank you guys so much.